The first couple weeks after your knee replacement surgery, you are going to be laying down and sitting a lot more than you are used to. So this is when your back pain starts to increase, especially if you've had a history of back pain. This is when it starts to get a little bit harder. Even the limping causes increased back pain. There's a lot of things that are happening that cause the increased back pain. I'm going to give you some exercise ideas to try for those first couple weeks where you're more laying down in bed more often, you're sitting on the couch more often in your recliner, things like that. So I'll give you some stretches to try. For those of you who don't know me, my name is Dr. Samantha Smith. I am a physical therapist that specializes in knee replacements. I have a website solely dedicated to knee replacement recovery. It's called succeedcourses.com. I teach exercise classes. I have educational courses for you to succeed with your new knee. That is the slogan of my website. So please check it out if you're looking for more guidance with your knee replacement recovery. But let's go over some stretches to try for your back. So one you can do sitting at the edge of the bed. I like this one for sitting up in particular. You can do this one on the couch as well. So we're going to do a side bend. If you don't have a lot of side bend, you can use a pillow. So you'll just want to fold up a pillow right next to you. You're just going to put your forearm on the pillow, and then your other hand is going to go up and over. And we're just stretching to the side here. So the goal is to stack the shoulders one on top of the other. So a lot of times people like to round forward. So make sure you kind of rotate backwards, and you should really feel a big stretch along the side of your body. Another tip, keep that hip down on your bed or on your couch and just hold this stretch here. You can hold this about 15, 20 seconds. And then we're going to go to the other side. For those of you who are more flexible, you can put that forearm on the bed or the couch. Do the exact same thing. So really open up, stack those shoulders on top of the other one, and we're stretching here about 15 to 30 seconds. You can make this stretch more intense if you really reach. Keep that hip on the bed or on the couch. And we're just holding this here. So that is a great one to loosen up the back. Another one you can try is going to be your twist. So good one to kind of keep the spine moving. The spine is designed to move. Sometimes people are scared of spinal twist, but the spine is designed to twist. So it's okay to twist it. So just gentle twist, kind of just twisting to the side. We're keeping those hips forward. We're really only twisting at the lumbar spine. So just like this, again, you can hold it about 10 seconds. And then switch to the other side and just go as far as you can, whatever is comfortable for you. And even for some of you who are more flexible, you can try to turn and face the opposite wall a little bit. Just get a really good twist in. And we kind of just go back and forth. I like to do each side 2 times here. Okay, and another one, we're going to do cat-cow. So for any of you who've done yoga, we're just going to rotate our hips forward and arch the low back. And then we're going to go right into, I believe this one is called cat and this one is called cow. I might have those mixed up. I'm not a yoga instructor. So this one, we're just arching the back and then rounding the back. Again, our spine is designed to move. I like to incorporate the shoulders into it, really round those shoulders, and then really open up those shoulders to get your spine moving. Again, these are great to do those first couple weeks after surgery when you're laying so much that back starts to tighten up. This is a great one to do. Our next one, you're going to put both feet on your bed or on your couch. So with your knee replacement leg, you might need to help it up, especially if those first couple weeks after surgery, kind of lift it up. Hopefully you can get it up there. If not, have somebody help you. We're just going to have both legs straight out in front of you. And if you can, just try to reach forward. We're just going to stretch those hamstrings. So this is a great one to get that knee nice and straight, but this also helps the back so much because those hamstrings are attached to your pelvis, and your pelvis is obviously attached to your lumbar spine. So we're really getting a good stretch here. And we're stretching both legs when you do it like this. So another great one, and just do the best you can. I know the knee replacement knee is going to be a little bit more challenging to stretch for a long period of time. So just do the best you can here. Our last one, we're going to lay back and we're going to have both legs bent. Again, knee replacement leg, your bending might not be too good quite yet, so just bend it as far as you can. We're just going to drape the legs over to the side and just give that back a nice stretch. You might need somebody to help you with this one to kind of lift your leg over on that knee replacement side, and we're rotating back. So just back and forth, we're just working on the spine. So just have somebody just kind of lift your leg over to really get that spine to move and just rotate. We're just trying to get your joints to move. We always say in PT that motion is lotion. The more you move, the more you kind of lubricate your joints and the muscles kind of get loosened up. We need that increased blood flow to help lessen the stiffness in your back. And I'm sure the knee is getting stiff too if you're recovering from a knee replacement. So these are also great just to help increase blood flow altogether. So there are some couple exercises you can try. This was a requested video from somebody in my Facebook group. So if you aren't in the Facebook group, it's a free support group. Somebody had mentioned we need some exercises to do for those first few weeks after surgery because my back was so tight. I was laying down so much and the PT wasn't giving me anything. So this video is for that exact reason. But thank you for watching. I'll see you again next time.